Hi there. Firstly, can I thank you very much for buying Lightsmer's Action? And I know that you, as a caregiver or a stroke survivor, you're going to be able to design a successful physical rehabilitation program in your home with the advice that I've given you in this book. I'm Dr. Kenneth Monaghan, a neuroplasticity expert and a rehabilitation specialist. I have an absolute passion for making your home the best place to run a rehabilitation or physical recovery program after you've had a stroke. I'm really excited to finally publish Lightsmer's Action because over the last 30 years as a physical therapist, I've seen the number of new therapies that have evolved and skyrocketed. However, it's clear that a very definite plan or a recipe for home-based programs that'll give you confidence and guidance is not available. So Lightsmer's Actions is that plan and it is that guide, and it's going to help you to continue your recovery at home. So this book has the recipe for the successful recovery of your movement, your strength and your function. And that function can be balance or it can be your walking ability. And it's all the information that your caregiver or your stroke survivor needs to know at home. I know as a physical therapist that if proven therapies can be carried out intensely, then extra recovery through neuroplasticity is certainly guaranteed for you and your stroke survivor. I must say that as a physical therapist, over the last 30 years, I've learned that 80% of the success of my treatments is based on the psychological aspect of these treatments, rather than just the physiological side of things. So what I mean is that if your stroke survivor actually believes that they're going to get an improvement because of the therapies that they're undertaking, then they will get an improvement, because your brain is capable of actually creating the environment, the chemicals in your body to allow this to happen. So what your stroke survivor believes is just so important. And we'll teach you this within the book. As a caregiver, we'll teach you the important messages to educate them with. Can I say that it's absolutely important and vital that a caregiver is involved in the stroke recovery program at home, because it's nearly impossible for a stroke survivor to carry out 100% of the therapies that they need to work on within their own home, just from a safety and from a helping hand point of view. And this is absolutely vital for success. Can I also say that you need to read Lightsmer's Actions from start to finish in that order, because the educational part of the information has been set at the right point in the book, and learning and educating your stroke survivor beforehand is so important before we start the actual therapies. If you want my contact details, please look at my website, lightsmersaction.com, and also at the end of this chapter, in chapter 1, you'll find those details. And please make contact with me if you ever want advice. So, as a caregiver, I must insist that the starting point for your stroke survivor is that you educate them at the start about 3 main pillars that have become the focus of my recovery model for care. And the 3 main pillars involve the following. So the first is a thing called neuroplasticity. And neuroplasticity is essentially that ability of our brains to rewire themselves or to recover and rebuild themselves, rebuilding new pathways based on everything that we experience. And what's very exciting about this is that those experiences can be physical experiences where you're actually engaging in certain activities, or they can be mental or visualization activities where you're not actually physically taking part in them, but both are equally capable of actually rewiring your brain. And your stroke survivor must understand that this is capable of happening, so they know that a recovery or further recovery is possible. I founded the Neuroplasticity Research Group in my university, the Atlantic Technological University in Ireland. And we have developed a number of innovative therapies that I discuss in the book. In the book, I show a very cost-effective way of carrying out those therapies. So you'll be able to carry them out with very little expense in your own home. Second pillar of the model is the idea that patient must believe themselves. The second pillar within my recovery model is the patient belief system. So what I mean by this is that it's vital that everyone, including your stroke survivor, they must understand that our beliefs, what we actually believe in, produces a physiological response in our bodies in reaction to that. So our brains, they act like a pharmacy, so to speak. So if we believe that something is going to happen in our bodies, then our brains produce the chemicals and produce the environment that allows that to happen. So if we honestly believe that stretching, walking, mirror strengthening, sensory substitution, cross-education effect, the therapies that I have spent the last 15 years working on in our research group, if you honestly believe that these things can help you in your own home environment, then your body will respond accordingly and allow the best recovery possible for you. Also added to this is my absolute belief in the 10,000 hour rule principle from Malcolm Gladwell. So that principle that the more repetitions, the more hours of practice that you undertake, this will guarantee that you have the best recovery possible. And just to add to that, the latest UK and Irish stroke rehabilitation guidelines are advising that at least 3 hours daily of constant repetitions of exercises are carried out to try and give your stroke survivor the best recovery possible. So only this can happen. This can only happen in your own home. The final pillar here is the gold standard clinical evidence is absolutely essential. As a health professional, it's hugely important that the advice I give to caregivers and stroke survivors has very strong evidence base behind it. And can I reassure you that everything in Lights, Mirrors and Action has objective evidence behind it. It's the best quality evidence that's out there. So based on my beliefs and on my experience and on gold standard evidence, we've come to develop the programs within the book. The final very important point that you have to understand before you start is that there's no absolute best physical therapy treatment for recovery after stroke. There are probably 20 or 30 therapies that are out there. There are probably 20 or 30 therapies that are available that certainly do no harm. And your stroke survivor and your caregiver and your physical therapist between them will advise and give you recommendations of things to try out. In Lights, Mirrors, Actions, I recommend 6 particular therapies that I feel are the best combination to give you the best chance of recovery at home. But there are other therapies out there that are safe to carry out. So you can make a recovery at home as long as you take the guidance within the book and as long as you have a caregiver that's willing to help you and give you their support and ensure your safety as you carry out the programs. Caregivers, can I say that what's very important is that you ensure that the first 4 weeks of the program that I recommend is carried out. Why I say this is that it's very important that that initial 4 weeks groundwork is carried out so that the program has become almost habituated or become a habit for your stroke survivor. And once the program has become a bit of a habit, then it's going to be very difficult for them to actually stop, and they're going to get more benefit from that. So once we have the program as a habit, once you know how to record progress, and once you know how to educate your stroke survivor, then you're going to find that the program has its maximum benefit. So this self-help guide, this will only benefit you as a caregiver if both you and your stroke survivor, if you're 100% sure and clear about the motivations and reasons that you want to carry out the program. If you're not sure, and if you're not clear why you're committing to this repetitive physical activity program, then you probably will have a hard time keeping going when that initial 4 to 6 weeks is over and your progress has started to plateau a little bit. That's when motivation is very, very hard to keep going. Look, over the last 20 years since I dedicated my work towards rehabilitation, I've spoken to hundreds and probably thousands of stroke survivors and their caregivers, and many of the different motivations that they've mentioned include, maximizing neuroplasticity in their brains so that a better recovery can take place, reducing the chances that they'll have another stroke, trying to reduce or to minimize the amount of fatigue, the weakness in their leg and arm movements, the pain and the occurrence of seizures in themselves, and also trying to improve sensations that often can be diminished after a stroke. And obviously the final motivation is to kind of improve that decision making and speaking that's necessary to get a good recovery. As caregivers have also spoken to me, and they've said that, reducing depressions, maximizing the minimal amount of anxiety that happens in their stroke survivors is also very important to them. And reducing that pseudo-bulbar effect that can happen in stroke survivors, if possible, these are the things that motivate them to carry out a program in their own homes. So I'm excited that you're taking the book, you've decided you're going to follow along with the program, you're going to educate your stroke survivor in the way that I've shown with the different topics that I feel are essential. And if you do that, then this book is definitely going to be beneficial for your stroke survivor. There's no doubt. So let's hope that you have the inspiration you need. And if you need more inspiration, then my next video, this one here, is going to describe where I got my inspiration from that got me started on this journey. Can I thank you very, very much for listening?